Hello everyone, in this video we'll discuss about the important topics related to AIIMS nursing officer exam. Let's get into the video. First one, fluid calculation. In that fluid calculation we must know about the different calculation about the fluids and the micro dip or in the macro dip, different drips based on the fluid calculation will be there, and the formula for the fluid calculation is very important for the nursing officer exam. And drop factor formulas, and based on the electrolytes, and they will ask for the fluid calculation, the electrolyte changes in the body, like under they will ask. Next, coming to the second point, psychiatric disease. In that psychiatric diseases, they're mainly focused on the some diseases like schizophrenia, BPAD, organic brain disorder, depression, mania, clinical, in these diseases they are mainly focused about the clinical features and the signs and symptoms of these psychiatric diseases. Like that only they will ask for the clinical based questions. In that schizophrenia and all, they are asking for the 4 A's and all. Next, coming to the cardiac disease. In that cardiac disease, they will ask in the question related to myocardial infarction, congenital heart disease, RVF and LVF, cardiac markers and cardiac cycles. In that they will ask, they'll frame a question in that diseases, and also they will raise a question from the ECG changes and all. They will ask for the cardiac diseases in the electrolyte changes. If it is like what happens in the sodium high, what happens in the potassium low, like under cardiac changes they will ask. Next, coming to the ECG changes. In that ECG they ask in the image based question, like under what are the changes in the ECG, and what is the duration gap and electrolyte imbalance on the ECG, and ECG changes indication. What are if it is variations in the ECG graph, what it will indicate the diseases in the cardiac system or renal system, like and all, they will ask. Next, in ABG analysis, in that ABG analysis, they will ask for the uh, calculation of the ABG analysis. What are all the changes in ABG analysis, uh, oxygenal changes and metabolic changes, like that they will ask. Next, coming to the next point, communicable diseases. In that communicable diseases, they frame the questions in the image based questions only, and many of the questions came from the chickenpox, scabies, and gangrenes, dengue, malaria, HIV. In these diseases they will frame majority of the questions in the communicable diseases only. Next, coming to the dermatological disease. In the dermatological diseases, in the previous 2 3 exams, they will ask only image based questions, uh, what are all the skin diseases, image based questions will frame. In children's, they in coming to the anthropometric measurements, in the children's, the variations and malnutritions, like under, and they will frame the questions in the children's. And in anthropometric measurements, what we should remember is the values of the measurements and the SAM, MAM, and age calculation of the children's based upon the weight and the uh, height, and weight calculations, height calculation, age calculation, like under, they will ask in the frame the questions in the anthropometric measurements. Next, coming to the burns. In that burns, they will frame the questions in the image based questions, degrees of burns and calculation of the burns, percentage of the burns calculation, and degrees of burns, how much depth of the burn happens. In that image based questions will frame. and the formula for calculation of burns they will ask, and they will give value for the percentage of burns, and we have to calculate it for the answer. Next, coming to the splint. Splint, they will ask the type of the splint and the diagrams, image based questions will frame, and and also they will ask for the anima in that types, and they based upon the clinical questions will frame that which type of anima will give in the which situation, like, and all questions will come. And anima also splint cast, in that cast also they ask for the type of the cast and all. Next, coming to the pelvis and the fetal skull. In that pelvis, they frame the questions about the pelvis and the type of pelvis and the measurement of the pelvis, and the position of the fetus and the in that fetal skull, and the measurement of the fetal skulls. Next, emergency trolley. In that emergency trolley, they frame the questions like what are all the drugs available in the emergency trolley, and different names of the emergency trolley like crash cart, and the instruments kept in the emergency trolley frame about in that questions, the size and color of the instruments and the cannula, and next, coming to the OT and labor instruments. In that also they give they frame the image based questions, in that instruments, and they will ask major common surgeries and post-operative cares. In that, major common surgeries like appendicitis and cardiac surgeries, and, and after that they will not ask about the during the surgery. They will, most of them asked in the post-operative care, in where we are our role is there at that situation. They will frame the question. Drug calculation and administration route site for both adult and pediatric. Mm. And also fluid calculation and drug calculation is the most important things in the topics in the NORCET exam. Next, family planning methods. In that, they will ask about the instruments and the duration and the pills method, the calendar method, and types of the family planning method, like, and all. They will ask. Next, invasive procedures. In that, invasive procedures mainly focused on the lumbar puncture and the kidney disease, brain fibrillation positions, and uh, like, and all. And they will ask in the invasive procedures. Next, developmental milestones. In the developmental milestone, as they'll ask about the theories and the, like, and all, psychoanalytical theory, and the major changes in the babies, like, and all. They will ask. Next, coming to the abnormal heart and lung sounds. In that, image based questions is there, and video based questions also there. Next, drug classification and psychiatric drug. The will the most asked in the psychiatric drugs, like about lithium and calciums, and next, blood vacuum containers. In that, and they will ask for the image based questions like color of the vacuum container and the content, and what are all the major, in that blood vacuum container. They will ask for the type of the vacuum container, and for the procedures, what are all the vacuum thinner to be used, like and all, and they will ask. And next, coming to the type of bandages and how to apply the bandages, like and all, they will ask. Next, calculation of the mean arterial pressure and the pulse pressure calculation, they will ask. Next, nurses day theme 2022, 21, 2019, 20. We must any one of them they will ask. And WHO theme 20, 21, 22, 19. Next, disaster triage, color coding. In this disaster management, how the nurse should take care of the patient in the disaster and the triage, and how we need to place the patients in the color coding systems, and they will ask. Next, chemotherapy. In that chemotherapy, they will ask about the type of the drugs, what are the drugs used in the radiation therapy and chemotherapy, and they will ask. And after chemotherapy symptoms, question mainly frame in the symptoms only. These are all the topics must know before 2 days of the exams. Just rewind these topics, that will help you to get more marks. Thank you.